Inner Door Center is an eating disorder treatment center along with an outpatient mental health clinic. We treat eating disorders across the spectrum from anorexia to bulimia, binge eating disorder, as well as substance abuse disorders and a variety of other psychological conditions within our clinic. Eating disorders are not without depression, anxiety. Many eating disorders result from trauma. Often you have co-occurring substance abuse disorders, other addictions. So we really have to treat everything together. Again, we're very integrated based on the yoga. Our treatment is very integrated. So we're not separating things out.
My role here at Inner Door Center is yoga therapist, and I also do some mealtime support and peer counseling with the clients.
Well, I struggled personally when I was younger, and I always wanted to give people the treatment that I never had. In my day, there wasn't programs like this. And also getting involved with yoga made me realize that there always has been a missing link to eating disorder treatment because you can talk and talk and talk about your feelings, but unless you're really experiencing what feeling is like and what feelings feel like, then you're really not getting to the root of the issue. So I created a multidisciplinary center to include yoga integrated with mainstream therapy. So it really gives people an opportunity to not just talk, but to experience.
In my personal recovery from bulimia, yoga was really instrumental for me. And I had gone through several eating disorder programs and treatment centers, and kind of walked away with a lot of knowledge and a lot of skills, but I didn't really believe it for myself, and I still struggled a lot with thoughts and a lot with accepting myself and loving myself. And so I found yoga, and at first it was about exercise and about burning calories, and but slowly it transformed into something much bigger for me.
We work with psychologists, psychiatrists, dietitians, creative arts practitioners, and our yoga therapists are really key into driving the whole yoga therapy program. But we're all integrated, we work together as a team, and the right people are here, which is great. So, we're able to work with each patient individually and take a look at what they're struggling with and be able to come up with a plan for them that's going to help them move forward in their lives.
Our Reconnect with Food program, we use the chakra system. Each week we focus on one of the 7 main chakras, and all of the life components that come along with that chakra, and we thread in yoga philosophy to basically everything that we do here, from not just the yoga therapy, but art therapy, group therapy, even lunch we do mindful silence.
We're really good at fighting for our patients, but some of the major insurances in Michigan don't even recognize eating disorders as a condition. They look at it as a choice, which is really unfortunate. There are many people that do pay for their treatment, but we work to educate insurance companies. We try to educate the legislature, the culture around here to how serious the condition is.
In an eating disorder, typically we've gotten pretty used to stuffing down emotion and not feeling it, not connecting to it, and really not connecting to one's body anymore, or wanting to even feel anything. So anything from an emotion to physical sensation, numbing out with thoughts, and using food as a way to cope. So yoga really helps to, one, restore a relationship with your body, are forced to do that. There's nowhere to really run on your yoga mat, you have to be there. So there's kind of the side of things that is restorative and gentle and renewing, calming, right? And then there's the side of yoga that's very confrontational and forces you to sit with emotions that are hard and deal with maybe insecurities in your body, or force some of that stuff to rise to the surface, and that's what we really want here. We want all of that stuff to rise up. And then as a team, we work through it and process it. You can't process something that you don't know is there. Right?
My message to those that are struggling, that's good, that there is help. You are not alone in your struggles, and you may wake up, every day and feel that there's never going to be a light at the end of the tunnel, and there truly is a light at the end of the tunnel, and we can help you find that light at Inner Door Center. Really, it's to find quality of life. We're not going to eradicate an eating disorder. An eating disorder isn't going to go away overnight. It's about managing one's life, being able to engage into life, to be productive. And it may not be necessarily waking up every day happy and joyful. It's learning how to sit with feelings.
I would say to anyone who is struggling, even if you don't know if you're ready to recover yet, but you know that you can no longer live this type of lifestyle, that it's not sustainable, reach out to someone that you trust and that can help hold your hand through the process of maybe slowly taking a first step towards a healthier and happier place, because an eating disorder is not a way to live. It's miserable. So reaching out to someone, and yeah, there is hope. Your life doesn't have to be like this. You can change it if you want to.